All right. Well, welcome. Thank you for your interest in yoga therapy for chronic pain. The intention of our time together today is to explain a little bit more about this 6-week program and what to expect. And this program specifically is for people living with chronic or persistent pain, and that's pain that's lasted more than 3 to 6 months, or the typical healing time that you've been provided by your healthcare provider. And this pain is causing you difficulties in your daily life, and you want to learn some perhaps new tools and techniques to influence and change your pain so that you can live better. So today I'll just be going over what to expect and what the outcomes may be, the learnings, and we'll try a short practice towards the end if time permits. So before I dive in, I'll just introduce myself. I'm Carrie. I'm a yoga teacher and a certified yoga therapist that work primarily with people with chronic or persistent pain, as well as in trauma recovery. And I have specialized training in pain care, as well as mentorship with Neil Pearson, where I've learned how to share and educate pain information in a more conducive way for the average person. So I'm passionate about doing this type of work because I have my own personal journey with chronic pain and in trauma. And um, I went for many years feeling really unsupported by different providers and healthcare, and having to continue with treatments without having a lot of hope or information about how to get better and to move better and get back to what felt a little more normal for myself. And I was really told that I would just have to stay as I was and live with the pain, which was pretty disheartening. And I did run into yoga as a practice. Actually, a friend dragged me there for the first time. And I noticed that over time, as I continued practicing yoga more, that I was feeling a little bit of relief in my body. And I was also feeling a reduction in stress. And that was really nice to see. I was also getting to know my body in different ways and learn how to better regulate. And these techniques and tools that I've learned over the years and through these different trainings are what I use in my daily life when I am experiencing pain flare-ups, and also when I experience acute pain and injuries. So I'm hoping that some of these tools will be something that you will be able to try out and find helpful as well. So pain is pretty complex and it's very unique for each of us. And we all experience pain in some form, whether it's an acute injury, whether it's in yoga or walking or other forms of movement, even in daily activities. And for a lot of us, especially those of us with persisting pain, we're experiencing pain without doing anything at all. In fact, and it can even get worse the less that we move. And so our pain can be influenced by many factors. Of course, how you move your body, but it's also things like your past experience. So, what is the experience that you've had where you've incurred this injury or had an encounter that has brought on pain? It also is to do with future worries, thinking about what could happen if you continue doing what you're doing. It also can be affected by things like our thoughts, our body tension, our breathing or lack of breathing. The breath holding can really affect things. Fear of movement, fear of injury, anxiety can be a big factor as well. And also things like grief and trauma. Our emotions and our sleep also play a role. So there's a lot of factors that affect our pain and discomfort. And for some of us, we have a tendency to push through pain. Many of us do that because we have to. We have to continue on. And so we ignore it, we push through it, and perhaps see increases in pain or discomfort. And there are others that will have a tendency to avoid and have maybe fear aversion with regards to pain. And there's a lot of us that do a bit of both. So we have a combination. Sometimes we push through, sometimes we hold back because we're fearful. And some pain goes away within the typical tissue healing time, and some of it sticks around. In fact, 1 in 5 Canadians have persistent or chronic pain, and that number continues to increase. And unfortunately, there's no magic tool or pill that we can take when it comes to persistent pain. But there are lots of tools and practices that we can explore to start to see some shifts, to start to influence the pain through these practices. And we want to really start to learn how to move safely. And we use our pain care movement guidelines to do that. And these are guides that get us to know our body, our breath, our protective mechanisms in a different way so that we can learn when is enough. When do we need to stop moving? When do we need to push ourselves more so that we can get these tissues healthier and we can move better? So with pain care yoga, it isn't just about one aspect. So we won't just focus on relaxation or just focus on yoga asana and movement. We're going to be looking at a combination of things. Pain science education is an important element of this, understanding how pain works and what's really happening with the signals and systems within the body, which can be really empowering, getting to know what's really happening. We're going to do a lot of exploration about our pain alarm systems. And so learning how our body is protecting itself in different ways, which may be contributing to increases in tension in pain, and how we can affect those protective mechanisms so that we can create more evidence of safety in our bodies and in our minds. So we're going to learn how to start to change those pain alarm systems to start to get them to go off less frequently, or maybe give us more space and movement before those pain alarms do go off. We're going to spend a whole lot of time around awareness. And so often we move straight to trying to fix or change something, and we may not spend the time to really get to know what's happening. So we'll be practicing awareness of our breath, awareness of our body and the sensations that we feel, the pain sensations, but also the other sensations, which sometimes we can't feel as often when the pain is shouting at us so loudly. So getting to know our body through awareness practices. We'll also spend some time on thoughts and emotions, and all of those are tools to help calm the nervous system. We will spend a lot of time practicing regulation tools. So regulation is where we regulate things like our breathing. We regulate things like our body tension, and we can also help to maintain the thoughts in more of a neutral and positive way. So we move from awareness, noticing what's happening, into regulating. How can we change things so that we feel better and more connected? We'll also spend a lot of time on the movement guidelines, so learning how to move safely. So each week we will be spending time on all of these aspects, ultimately so that you can gain tools so that you can take them into your daily life and start practicing them regularly so that you can feel relief. Because we know through research and through the lived experience of pain that it takes time and it takes practice and repetition. So it isn't that we come to our class once a week together and then where everything is great. It's we come to class together, we learn our tools, we practice, and then we take them with us and we practice through the week. And so how is this yoga therapy for chronic pain different from seeing another healthcare practitioner? So the expectation is not that you stop seeing your other healthcare. Absolutely, please do continue. They're there to support you and help you. This program is to help empower you with extra tools and more tools so that you can find relief and that you'll be using the resources within yourself. So you're using your body, your breath, your thoughts, and the tools that you learn. So they go hand in hand with the other treatments or tools that you're already using. So the format for the class each week will come together, whether you're taking the class in studio or you're taking it from home or you're catching up later, because all of these will be recorded. We usually start with a grounding practice or a centering, and then we'll check in and get to know our group a little bit. We'll talk about things like, what do we want to work on today? What are the experiences we had with the practices that we've been doing for the week? And it's really ends up being a really nice sharing and building of community together. And of course, the sharing piece is optional. If you would prefer to just observe, then you can do that. And from the sharing time, we go into a little bit of pain science. Just to each week, we will learn new aspects of that. And then we'll start to work on the practices like the awareness practices, the movement practices, the regulation practices. And each week will be different. Sometimes it will we'll have a specific area of focus, and sometimes it will be based on the collective group and what we need. Everything is optional. Movement, relaxation, everything is up to you. So if anything doesn't feel safe in your body, or we're working in a movement pattern that doesn't feel good for you, then you're welcome to leave it behind. You can move your own way, you can rest, and just continue to breathe. Each week you'll be sent handouts. So a handout for you to make notes on when you're in session. And then when after the session, you will receive copies of recordings of any of the practices that we've done. So I'll audio record the practices. You'll also receive a link to the recording of the whole session. So if you want to revisit the session or any aspects of it, you can do that. It's also helpful for those of you that may not be able to attend all 6. Often we'll have participants be able to be there for maybe 4 or 5, and then they have to catch up, and that's completely fine. These classes can be attended from a yoga mat, from a chair, from a bed. They can be standing or sitting, whatever feels best. And often we'll have students doing different variations based on what they need. So you will always be met where you are. There's no expectation here. So we know that movement is medicine, and any form of movement can be helpful. So there will be opportunities for challenge, but there will also be a lot of more subtle and smaller movements that you can incorporate into your day. And you can always visualize at any time if the movement doesn't feel safe. We'll always also include some relaxation practices at the end. And we will also be weaving in yoga philosophy and working through some of the yamas and niyamas, which are the ethical guidelines of yoga that just help us live a better life in harmony with ourselves and with others. And the guiding principle is ahimsa, which means non-harming or non-violence, and that is in relation to, how you move your body. Are you moving in a way that is honoring your body? What are you putting into your body? What are the thoughts? What is the self-talk like? Is it kind or gentle? And offering ourselves tools like compassion, really being gentle with ourselves. We're very often quite good at offering compassion outwardly, and it can be a little harder for us to do it for ourselves. So we'll be practicing that as well. So a few things to note before we try out a practice. This program is not for a specific condition or type of pain. So we see a wide variety of students with different abilities and different challenges and different gifts. So it's not for knee pain or back pain or fibromyalgia, it's for everybody. There's no yoga experience or fitness level required, really just a sense of curiosity and openness to learning some new practices. If you are coming to the studio and you have your own yoga mat, you're welcome to bring it. Wear comfortable clothes, bring water. If you're at home, set yourself up in a comfortable place. Bring pillows and blankets and any other props you might have, like yoga blocks. And so that's pretty much it. Just a reminder that you'll always be met where you are. You will have access to the recordings and tools, and we will also be working towards a home care plan. So what do you do after the 6 weeks together? How can you embody these practices and continue on your own? So we're going to try out a brief awareness practice, and this one specifically is for breath and body. So if you'd like to give it a try, just take a few moments to bring yourself into a comfortable position. And I know comfort is a relative term. So if you want to lay down, you can lay down. If you'd prefer to sit, you can, but just make sure you feel really supported. If you're noticing any tension in your body or that you're not quite sitting in a way that you can release that tension, then take a few moments to do that. And if you want to close your eyes, you can, but you don't have to. Start to bring your awareness towards your breath. And if it's helpful to use your hands to feel the breath, you can, but you don't have to. And just start to notice the breath moving through your body. Feel the air moving in through the nose. Notice the temperature of the air. Notice if the breath in is short or long. Perhaps you notice a pause in between the inhale and exhale. Notice if the breath is smooth or if it's feeling rough or sticky today. And there's no good or bad, we're just observing. Do your best to stay present with your breath. And now we'll shift our attention towards our body. And we'll start to scan the body. You can start down at your feet, noticing your feet and your ankles, any sensations, maybe where they're touching the support underneath you. And then start to take your awareness along your legs. Check in with your knees. Notice the sensation along your legs. Feel into the hips. Feel the weight of the hips. Noticing the whole lower body. Notice if there's tension, if there's differences between the left and the right, or there's certain areas that are calling your attention. And there's no good or bad, just observe. And continue to stay aware of your breathing as we move further up the body. So checking in now with your abdomen, your low back, noticing any sensations through the mid back and the solar plexus, feeling up across the chest, the whole rib cage, just noticing sensations, noticing the breath in and around this area as well. Feeling across the upper back, the shoulders, the shoulder blades. Noticing the tops of the shoulders and down the arms. Observing what's present. Feeling down to the hands and the fingertips. Just staying present with what you're noticing. And then bringing your attention back up the arms and towards heart center. Check in with your heart. Any thoughts, feelings, or emotions that are present or calling your attention. And moving the awareness up the throat and the neck and all the way across the head and face, noticing tension or holding. Just observing what's present in your body. Noticing the breath. And we do these awareness practices to bring ourselves into our body, to feel and notice the sensations, to also provide focus. So now we're present, we're here, we're not future, we're not stuck in the past, we're experiencing what's present. And when we notice tension or pain in the body, or we notice that we're not breathing, or maybe the breath is short or shallow, we're getting information about what we might need, what is going to support us in feeling better. Some days it will be movement, some days it will be more rest, some days it'll be calming practices and regulation, some days it will be just coping, and it's going to be different for all of us, and it will change day to day. So we move from awareness, noticing, checking in, getting that information into now what? Now we want to move into regulating. So what can we do to shift and change so that we feel better, so that we feel more connected, so that the nervous system can regulate? So this is where we move into breathing exercises and movement practices, other practices like tension release. So I'm going to guide you through a very short version of a regulation practice. We're going to start with establishing our breath, and then we're going to add a layer of movement. So again, you can be in a comfortable position. You don't have to be seated. If you want to stay laying down, you're welcome to do that. And if you need to shift right now, like I am, please do that and take care of yourself. Let your hands rest wherever you want them to, and just find a natural breath. You can also check in and just notice the breath again. So this breath practice, this breath regulation technique, I like to call it candle breathing. So we're going to breathe in through the nose slowly, and then we'll softly breathe out from the mouth like you're blowing out a candle. So whenever you're ready, take a long breath in through the nose and softly release the breath from the mouth. Do that a few more times. Slow breath in through the nose and a longer breath out from the mouth. Let it be gentle and slow. Breathing in through the nose and softly release from the mouth. Taking 5 or more breaths that are slow and calm can help reduce your stress hormone levels by upwards of 50%. So we're going to add on a layer. You can continue breathing in through the nose and out from the mouth, or you can switch to breathing in and out from the nose. We try to use the nose as a filter for our nervous system. So we're going to add a layer of movement now, but you're going to move in a way that feels safe for you today. So if I'm lifting my shoulders way up and that doesn't feel good, you're just going to lift part way. Or maybe you have one shoulder that doesn't feel safe moving, you're just going to focus on one side. So we're going to move our shoulders up on the breath in and then down on the breath out. And then we're going to add some arm reaches. So whenever you're ready, breathing in, lifting the shoulders as high as you want to. Feel that tension. And then as you exhale, slowly melt it away. Let go of the tension. Good. Repeating a few more times. lifting up with the inhale and slowly releasing with the exhale. So we're moving rhythmically with our breath. Good. So we're going to start to reach our arms up and down now, one arm at a time. You decide if you want to lift laterally or forward. Just let it be spacious for the shoulders. So on the inhale, you'll lift the arm up as high as you want to. Keep the tension low. And then exhale, let it float back down. And then try out the other side. This might be a different range of motion, and that's okay. Meet yourself where you are. Keep breathing. Move with your breath. Inhale up. Exhale down. Good. So we're going to try doing both at the same time now, and it's okay if they move in different ranges of motion. Inhale to lift up, and exhale to draw back down. Now, if you want to add on, you could look up when you reach up, and maybe you lift up higher this time. You can look up, and then as you exhale, return back down. Good. So you find your range of motion that feels good in your body. Keep breathing and try and keep the tension low. Good. So we move with our breath. You could continue on your own if you want to. And then as we start to explore the movement guidelines, we're going to add on and we're going to start to go to edges of stretch or tension or even pain. And we're going to try and explore them safely, stay and breathe and soften the tension if it feels safe to stay there. Of course, if it doesn't, you're going to reduce the range of motion, take the hand down, or pause and visualize instead. So we explore with curiosity, going to a range of motion that feels safe, and we try and breathe calmly and soften the tension. There'll be a variety of different movements that we explore. Some will be laying down, seated, standing, and of course you'll have options throughout. So those are just a few samples of some of the practices that we would explore. This program that is coming up is beginning on Thursday, November 6th. It's going to run from 12:30 to 1:30 in the afternoon, and it will be recorded if you can't make them all. They can be attended here in the studio or from home, and you can also alternate. So sometimes people come in, sometimes people take it from home. So I'm going to pause the recording and take any questions, and you'll also be emailed out a copy of this info session. And if you do have any questions afterwards, please just reach out, and we hope to see you soon.